Hi, I'm Dr. Carol Lawyer. I'm a veterinary cardiologist, and I'm the founder of EchoVet. Today, we're going to look at doing a POCUS exam, POCUS and Plus, and we'll just come right back from EchoVet. We've signed in, and so we'll just proceed to an EchoVet exam, and this is where I would get in to EchoVet, and so we'll just move our way into EchoVet. And EchoVet's now in, and we're logged into EchoVet. I'm going to go to a patient here, and let's just do an abdominal exam here, or if we want, or we can just go back. We're going to go back to the main menu, go to a patient, and let's go to a POCUS and Plus that I've already got in here. I've just put in basic details about this animal. It's an Anglo-Francais de Petite. Wow, never heard of it. Okay, so we're in fast and POCUS here, and we're not doing a fast exam, although a lot of the things that we'll do for fast also applies to POCUS. And so we're putting in what we're finding. POCUS is a point of care ultrasound. So this is where a stethoscope is an extension of your physical exam, or not a stethoscope, but a ultrasound probe, just like your stethoscope. So you would just, you've got a sick animal, you'd put a probe on it to figure out what you might learn from that. And so we're going to go into abdominal, and these are basic questions to answer. Does he have abdominal effusion? And he does. He's got a little bit in the subxiphoid view. You would do a scan like that through the abdomen. You'll learn that in some of the courses you might take. Does he have pneumoperitoneum? He has no free air. We're doing them in right lateral. Can we assess urine production? We're answering questions in a POCUS exam, point of care ultrasound. And he's got a urinary bladder, and that looks pretty good. Does he have signs of anaphylaxis, the gallbladder halo sign, basically? So he's got a halo sign, and we can say something about that. Suggests anaphylaxis or pericardial effusion. So we'll use that in our report. That's an easy thing. And in a cat, do they have renal pelvic dilation? These are questions that we're answering. If we go to the thorax, we're going to answer, is there pleural effusion? And we can see that in the right thorax. Do we see pleural effusion in the left thorax? Pneumothorax is harder to evaluate and not nearly as sensitive or specific. And so that's kind of a little, we'll get through that. And then we can see, do they have fluid? Do they have B lines? And so if they have B lines or lung rockets, that's a sign that they might have pulmonary edema of some kind or another, cardiogenic or non-cardiogenic. And so we're saying we have these B lines, and so we're going to say something about that. It rules out pneumothorax and suggests pulmonary contusions or pulmonary edema, and we're going to use that in our report. And so we'll do that in both the left and the right thorax. And then, do they have any subpleural lesions? These are masses, essentially. And then we've done a thoracic point of care, and we can go to the cardiac point of care, and we can say, does he have pericardial effusion? What's contractility like? We can put in numbers. I've provided very basic things so we can analyze numbers quickly and see if this dog is dilated or not, if function is normal. Just basic, very basic stuff. And what's his volume? We're going to do that by looking at his left ventricle, and we're going to say his filling is normal. And then what is left atrial size? Again, very basic 2D numbers to say left atrial size is normal. Is there cardiac involvement or not? So this is a very basic. We just did a very quick exam on this dog that took very little time. We put that in, and we have generated a report. And this report, now we can load that report, and we'll close this window, and then we'll just go look at that report. And we have a nice report that we can present to the client. We can charge for what we just did. So we have a complete report generated on that animal. And then this is a report that it's just not a scribble in the medical record. It's actually a really nice report to put into the medical record and then be able to come back to later. And this is all stored within your instance of EchoVet. So there it is. There's a FAST and POCUS exam. We did that quickly. And so go to echovet.com and sign up and use EchoVet. Thanks for watching. Appreciate that. Please hit the subscribe button and allow notifications, and give us a thumbs up as well. It gets us out to other veterinarians around the world, and so that we can start using ultrasound more just as a routine modality in our profession. Thanks a lot.